So I would like to call the meeting to order. And the first order of business is approval of the agenda, which Jody helpfully sent. I will share the agenda. You can see we have guest speakers today. That's the big, we're going to be talking about the direct support professional, workforce crisis, and some surveys that have been done. We may end up deferring the usual agenda items. So anyway, that's what we've got. Can I have a motion to approve this agenda? Yay, Ron Melka, thank you.
That was quicker than taking me off mute.
How about,
second.
Was that Jane? Thank you. Okay. So
Lynn, maybe we could, Kathy had a good point, is maybe we could go around and have quick introductions, listing our organization and what area we're coming from in the state, so she kind of has an idea of where we're representing, if that would be okay.
I think that's great. Thank you, Kathy. So, well, I'll start. I'm Lynn Canfield. I'm the chair of the DD committee for ACMHAI, and my community is Champaign County, Illinois, and we have a 708 board and a DD board. Both have a responsibility to funding DD services and planning a system. So this is really great for us. I'll pass. How about to Jody?
Thanks, Lynn. Jody Dart, coordinator for ACMHAI. I'm here in Springfield, but obviously statewide with the organization. Pass it on to Ron.
I'm Ron Melka. I'm president of ACMHAI and executive director of Lyons Township Mental Health Commission in the western suburbs of Chicago. And we have a 708 board, but about more than a third of our funding goes toward DD services. And I'm going to pass it to Deanna.
Good morning, I'm Deanna Cada. I'm the executive director of the Dekalb County Community Mental Health Board. I'm currently the vice president of ACMHAI, but will be stepping down at the end of this year.
Hi, Kathy. It's Jane Nesbitt. Nice to see you. I'm now the associate director of the St. Clair County Mental Health 708 Board.
I'll step up. I'm Terry Braun from the McHenry County Mental Health Board, currently serving as interim executive director, but normally deputy director. I'll pass it off to Colleen.
Hi, everyone. I'm Colleen Belia. I am the operations manager for Inc. Board. We work with 708 boards in 7 townships to coordinate funding from the taxpayer mental health levies to local agencies. And right now we provide funding for 33 programs and 15 agencies in Southern Kane County.
I'm Kim Baldry. I'm the Associate Director for Intellectual and Developmental Disabilities for the Champaign County Mental Health and Developmental Disabilities Boards.
Good morning, everyone. I'm Leon Bryson. I've had my cup of coffee today, which is a phenomenal thing. Associate Director for Mental Health and Substance Use Disorder here in our lovely Champaign County. So, good morning.
And Abby, would you mind introducing yourself? Are you in a position to do it? I can do it for her. Abigail Hernandez is a senior in the School of Social Work here at the U of I, and she and a colleague are working on a project for us to talk about the workforce, the DSP workforce crisis, and review some potential solutions that other communities have offered, and then to sort of dig deep into what the underlying causes might be. So I'm very happy that Abby made it to this meeting. Jody, is it okay if I introduce the first presenter, or do you want to, are you ready to do it?
No, I'm good. Go ahead. Thank you. Whichever we prefer.
You put all this together, so if you wanted, well, anyway, I'll do the first part of the introduction. Kathy Carmody is the CEO of the Institute on Public Policy for People with Disabilities. And we had a conversation late last week, and I discovered, I'm going to spill the beans, Ms. Carmody, that she also was a DSP in a former life. So a whole bunch of us on this call have done that work. Just wanted to say it's kind of a neat thing to be connected through. So anyway, she's going to talk to us about the workforce crisis and the impacts and a survey that they've done. So thank you. Did I miss anything?
No, thank you. Good morning, everybody. I appreciate the opportunity to meet new friends, check in with some old friends. Jane, it's great to see you on screen. And I know I've crossed paths with several others of you. I had mentioned that I had done an in-person presentation to this larger group, not just the IDD committee, back in the days when we used to meet with people in person, and very much enjoyed that opportunity. And it's helpful to hear where folks are from. I took notes. Honestly, I think our members of the Institute are connected to many of you in your local communities. And I think have a real appreciation for the value and the investment that your bodies bring to the entire social service arena in local communities. So I'm again happy to have been asked to participate today. And yes, I did, as Lynn said, begin my career in Michigan, my home state, as a drug support person about not quite 40 years ago, but a long, long time ago. I've been in the Illinois system since 1985. And have worked at both the system level, the organizational level, and now have been for the past 6 years in the position of the CEO of the Institute on Public Policy for People with Disabilities. And we are a statewide association of community organizations that provide direct services to people with intellectual and developmental disabilities. Our members serve about 22,000 people across the state of Illinois. And our ISC members represent or provide services to close to 10,000 people in the service delivery system. So we've got a pretty broad reach and scope. Part of what I've done with the Institute, people may have heard of the They Deserve More coalition. And a lot of the surveying that I've done through the Institute has kind of involved that loose coalition of advocates and organizations across the state. So, and I see my colleague Ed has joined us. I've got a few bullet points that I just want to talk about, and I've probably added some thoughts since we talked yesterday. And really, I don't expect I'm telling any of you anything that you don't already have a sense of or a taste for. Maybe give you a few crystallized nuggets of some kind of boots on the ground reports that we're getting from our member organizations. I will just say, unfortunately, and I think many of us who've been in the field for a long time, it's almost a tired statement to say, I've never seen it this bad, but I just, again, and I've been in Illinois since 1985. And, you know, I think the ripple effects that we're seeing in our industry of the pandemic, the economy, you know, demographic trends that are impacting, you know, industries beyond IDD, but certainly ours as well. I think it's just sort of a tsunami has hit. I have said, you know, and again, I always say we're all adults. I'm not going to sugarcoat things. I say the same thing when I talk to parents. I think parents have the right to understand what they're dealing with and what they shouldn't be surprised by. And I just don't see our industry returning to the good old days, whatever those were and whenever they were, because I, again, having been here since 1985, I don't think we ever thought we were in the good old days. But I think as we look back, we sort of, as does happen, you get kind of nostalgic for, boy, I wish it was 1998, because, you know, whatever we thought our problems were then, they don't seem as significant as what we're facing today. So I'm going to talk just briefly, and I know Ed has a more recent survey that he'll talk about as well. I'm going to, this is where it all, you know, can potentially fall to pieces, is when I try and share my screen. So we'll try that. Here we go. So I'm just going to share a couple highlights from a survey that the Institute led in partnership with They Deserve More back in late spring. And, you know, if you recall back in late spring, we thought things were going to get better in September, because we thought that the impact of extended unemployment and people's continuing kind of, let me see what happens before I decide what I'm going to do for myself and my family. We thought all of that would be behind us by where we are now in November of 2021. And I think what we see is that we're still dealing with many of those concerns. So just to give you kind of, again, a reference, sorry, I'm trying to move some things around so you can see my full screen. Just the section that I'm trying to highlight here. We did a survey of community organizations statewide. Collectively, they serve more than 6,000 children and adults with IDD. And just to give you sort of a reference, there's about 11,600 people in SILA services across the state, just under 5,000 people in private ICFDDs. So this wasn't, you know, every person being supported, but maybe a large enough sample that we can presume it reflects some things going on industry-wide. Within those agencies responding, of the 6,800 DSP positions in staff plans, 1,800 were vacant, resulting in a 25% staff vacancy rate. And of our respondents, hi, Chris, I just saw you on there. Good to see you. Another one of my old friends. Of our respondents, 35% reported vacancy rates greater than 25%, accounting for 46% of total budgeted DSP positions. So what that says is that in organizations, nearly organizations that represent nearly 50% of DSPs in the sample, there was a vacancy rate of greater than 25%. And again, this was back in May, and I can tell you sort of anecdotally, things have not gotten any better since that time. If anything, the competition for employees and the competition for starting wages, the impact of minimum wage increases up here in the Chicago metropolitan area are all factors that have just continued to put pressure on community organizations. And you see on here these bullet points. One of the things that I talk a lot about is, and I've got an item, Jody, I'll forward to you. I didn't send it in materials yesterday, but when I came across it today, just prepping for this, I thought, oh, this might be something of interest. One of the things that concerns me personally is I think policymakers, and by that I mean kind of legislators, and for some of you, maybe your county board members who you report to, I think people have a genuine interest and concern in our population. I get concerned that when they visualize who we support, they have a very different picture in their mind. And you know, Jane, you might have some insight into this as well with your experience. I think people think we support the folks who bag groceries at their local grocery store. Or they say, yeah, my neighbor has a son who's in Special Olympics, and I know who you are. I know who those people are. But really, the profile of people in SILA services today is reflected in these bullet points here, and I've got data to better capture that. It is an elder population. It is a medically involved population. It is a population that relies on staff for daily personal care needs. It is not, I think, the vision that many policymakers and legislators have. And so it's, I think, a little more challenging for them to understand the impact that the workforce crisis has, because we literally, as an industry in Illinois, support people who depend on you know, a set of hands from personal staff to get through their day. And when there's only one set of hands in a SILA setting with 8 people, we can all appreciate the challenge and the impact that that has on the folks living there who are truly dependent on the staff supporting them. I just want to highlight a couple of other points, and this is, you know, what you see again on the screen here is a reference. 64% of SILA sites in Illinois support 6 to 8 people. So again, in many states, they don't allow sites that big as what I always call group homes, because I think that's what most people generically think of our programs as, is group homes, and that's fine. So 64% of our sites in Illinois serve up to 6 to 8 people. And again, there are many of those sites that have 1 person on duty. Literally, they should have more. They want to have more. They don't have the personnel to have more. And so when you go back to those kinds of personal care needs that the people living in SILA groups, SILA group homes have, the challenge that that causes for the staff on duty, the burnout, the anxiety, the risk, we can all appreciate. And again, I know you said there's many of us who began our careers as DSP. I will say that that's kind of that's a litmus test in my mind in our industry. When I kind of look sometimes at people who have a lot of ideas about us, the first thing I say is, are they going to survive an 8-hour shift in a group home? That's my litmus test. Would this person make it through an 8-hour shift? And many of them would, many of us have, but there's sometimes people who I think, you don't know what you're talking about. You don't know what the demands are in that setting and, the supports that people need. So you see here, 40% of our current SILA population, based on the ICAP, the assessment tool that we use for every SILA person, 40% of people in SILA services are defined as total and extensive personal care and intense or constant supervision. What I always say, and this will again take my current or former ISC friends back to this whole PUNS list of crisis versus emergency versus urgent. I always said, I don't understand the difference between all those. They all sound bad. And total and extensive and intense and constant, I don't really know quite how you define the differences. If 40% of people we support are assessed as having that level of care needs, and they're living in SILA settings that are experiencing a tremendous staffing crisis. So I think it's reasonable for us to assume that there are some needs that aren't getting met. And then I just want to do one final data point from our survey. And I can't quite highlight on here while I'm titrating between platforms, but so, and I said, this is I think the most ominous finding of the survey, and this was in late May 2021. Our respondents reported a net loss of DSPs in calendar year 2021. So in the 5 months that we had experienced in 2021, the overall pool of DSPs shrunk by 255 persons for the respondents to this survey. And again, the respondents to the survey serve 6,800 people. So, and again, recruitment is literally ground to a halt. I'm going to stop sharing now. We simply agencies can't compete. I was on with a very, very well-regarded CEO of an organization here in the metropolitan area yesterday, who informed me, that he's likely, kind of hanging up his hat sooner than he would have thought, just because of the impact this has. His organization is paying starting wages between $18 and $21 an hour and is not getting any applicants. So that is where things are at. You know it, we are hit with it in the face every day. I want to just briefly, talk about some thoughts I had about, what role organizations that you represent might play as partners with the organizations that are in your communities. Any kind of advocacy or awareness about the opportunities in the IDD space for people. One of the things I always said during COVID, well, we're still in COVID, right? But I mean, our employees, I always felt were so much safer than somebody working at the local grocery store, because there really was very tight controls over who went in and out of a setting. We had, staff were limited to 1 or 2 staff rotating. So from that safety perspective, one of the things we tried to highlight was we have some of the safest jobs. We're not in a hospital where anyone can come in off the street. I mean, there are some safety features of the employment opportunities in the IDD space. I think technology investments, that is a huge topic and area for our organization, for industry-wide, for looking at ways that we can continue to support people, more similar to how you and I all live our lives. Right now, we're all on a Zoom platform where we're communicating. We're not in person. And there's a lot of opportunities for substitution of in-person, staffing, and ways that organizations could continue to provide support. There's a lot of upfront investment in technology that's required for that is not Medicaid waiver reimbursable. So we really do kind of hit a wall, even though there's a recognition of a long-term return on investment. And that could be, some interesting pilot opportunities, maybe even as a network that could be tested. There's a lot of interest and appetite among IDD organizations for exploring those pathways, but just not as much capital to be able to pursue it. We talked yesterday, the BLS, Bureau of Labor Statistics classification for DSPs is something that, our national organization Anchor is certainly a part of leading that effort in DC. We strongly support, we do view DSP positions as very different than many other aid positions. And we believe that it needs to be a distinct and standalone. So we support that advocacy effort and would certainly work in partnership with your organization and your statewide organization and individual ones in trying to pursue that. I'm going to do 3 bullet points just on some things that are happening. The DD division is convening a committee to try to explore concerns in this area and potential strategies and solutions. Agencies continue to get enhanced reimbursements from the state as long as the public health emergency remains in place through our Appendix K that was submitted to the federal government. So that is at least, a Band-Aid. And then we do have pending FY22 rate increases that we hope will be materializing in January. Those are kind of being vetted right now at the federal government level. And until we get the seal of approval from Centers for Medicaid and Medicare Services, the state cannot implement those. So those are some things that are on the horizon. And with that, I think I've gone 20 minutes, so I will stop talking. I will hand it back to whomever, Jody or Lynn, and then I think passing along to Ed.
Thank you, Kathy. So Jody, I think you should do the next introduction. Do we want to do Q&A right now or wait till the end?
Whatever everybody else wants to do, whatever you think's best. If we want to wait a little bit and we can do them all together, I mean, that's fine. If that works. Is that good?
Is that okay with Ms. Carmody and Ed McManus?
Okay.
Okay, great. All right.
Okay, well, our next guest is Ed McManus. He's a consultant with McManus Consulting. We approached him because we had learned of a survey that he had done with the CEOs of 31 agencies across the state that provide DD services. So we wanted to hear his take. I know he's got a report that he had provided, so we can share that with the screen, but on the screen share or however, Ed, but welcome and thanks for joining us.
Thank you, Jody, and I apologize for being late. But I have a good excuse. I had to wash my hair, and the reason I had to wash my hair is that during this doggone pandemic, you know, I let my hair grow. I haven't been to the barber in 2 years, and it looks like hell. So, but actually, it looks good, and my wife Ellen is very happy that I have longer hair. I used to have real short haircut, and I do have some nice gray up there. She thinks I look more dignified. I wanted to comment on one thing that Kathy said, just because I think it's a statistic that not too many people know, but she referred to the fact it was talking about 6 to 8 person SILAs, and I think, did you say it's about 60% of the state? Is that right? Yeah. And you know, that in itself, that's not what we're talking about today, but that's really a disgrace. The rest of the country averages the more than 50% of the group homes nationally are 3 persons or less. And so for the fact that most of ours are 6 to 8 is just really far out. So we have a long way to go. For those of you who don't know me, I worked, I was a Tribune reporter for many years in Springfield and Chicago. And then I went to work for the department and I worked there for 18 years as an attorney and running the home-based program and being what we called a network facilitator, like a regional manager. And then I retired 10 years ago, and I started this little consulting practice, which has grown significantly since then. And so I have contracts with a lot of agencies, and I also put out a monthly newsletter. And I'm a dad, which is how both Ellen and I got into this, is that our daughter, Laura, who lives in a SILA, was born with cerebral palsy. So enough about me. Last October, we decided to conduct a survey, and it was after the Division of DD had said that they had heard from a number of providers and trade associations that the staffing crisis was reaching critical levels. And so we had 31 CEOs of agencies from across the state participating in the survey. 25 of them were our own affiliates, and 6 of them were members of other provider associations. And I want to start out by quoting, just as I started out the report itself, by quoting one of those CEOs of one of the state's large provider agencies, responding to the question in the survey about how the staffing shortage is affecting the quality of services to our folks. No matter how long I sit at my keyboard, I cannot come up with words that describe the impact of the staffing emergency. Staffing is no longer a crisis. It has entered an emergency phase. 90% of leadership staff time is now spent trying to figure out staffing and get through the day. Obviously, the lack of staff and tired staff are not conducive to helping people access the things that they want in their lives. Providers have worked hard to this point to consolidate homes without discharging people from services. The next phase, unfortunately, will include closures with discharges. The current situation is beyond sad. The next phase, unfortunately, closing or consolidating homes are euphemisms. They do not begin to capture the impact on persons served or their families. People receiving services for no fault of their own are having to move from their homes and their preferred staff. And what could be worse? What could be worse? The reason I misspoke a moment ago was I was distracted by seeing Jane Nesbitt on the screen. And Jane, if I'd known you were going to be here, I would have gotten here on time. So anyhow, these folks that we surveyed, they serve a total of 2,600 individuals living in SILAs and 4,000 people who are in day programs. And the survey was intended to provide a snapshot of the state. It was not scientific. We simply invited all of our affiliated agencies to participate, as well as a number of members of other associations, and 31 of them responded. When we asked the 31 agencies if they are in danger of shutting down, actually going out of business, 30 of the 31 said no. The 31st agency said, quote, "It's obviously a critical and dire situation, but I will defer on responding at this time." So I kind of took that to mean that it certainly could be a possibility for that agency. And some of the agencies are shutting down houses, including the CEO that I quoted at the beginning, who said, "We have closed 3 houses in recent months, but we were able to move." And by the way, this all took place in early October, so it's about a month ago that I took the survey. We were able to move those people into vacancies, but it's not lost on us that people lost their homes. The next wave of closures in maybe 30 to 45 days will likely result in the people in 1 or 2 of our homes no longer being served by our agency. Well, I haven't checked back with him, but it's been 30 days since he said that. So in addition to asking about quality, the survey inquired about how the agencies are coping, how they feel DHS is handling the crisis, what percentage of their payroll is being used to pay overtime, and how their day program census compares to what it was before the pandemic. 10 of the 31 participating agencies said that more than 20% of their SILA payrolls are going for overtime. The agencies said that they were serving a total of 5,000 individuals in day programs in March 2020 when the pandemic began. And today they are serving only 4,100, which is a 19% drop. One large provider said that its community day services census plummeted from 650 in March 2020 to 450 today. The same agency said that it has spent $4 million on overtime in 18 months. So we asked the agencies how they felt that the DHS was handling the crisis. Half of them responded, and it turned out that eight of them had positive comments, and 8 of them had negative comments. I'm not going to go through it all, but some of the positive comments where I honestly don't believe this is a problem that is caused by a lack of support from the department. As an agency, we have felt supported. I feel that the division has done a commendable job recognizing changes needed in the system and advocating for them and communicating about it. On the negative side, DH is doing very little to handle the crisis. We are somewhat finding that DHS is ignoring the crisis. DHS has remained too rigidly tied to the rules. This is the time for innovation, but innovation doesn't seem to be part of their playbook. So those are, so half and half of the people that commented, some were happy and some were not. A few additional comments on the crisis. One agency said that over the last 18 months, they'd had a 50% turnover. Another one said that their current staffing level is at 57% of budgeted DSPs, and this critical level is not sustainable. Another one said 28% of our available positions remain open. IR also conducted a survey in September, and Josh Evans was generously shared the report with us. They found that an average of 22% of full-time DSP positions were vacant. One agency reported 44% vacant. They found that the average percentage of the total DSP payroll that was overtime pay was 22%. One agency reported, hold your breath, 83%. 83% of this agency's DSP payroll was overtime. And one agency said that they had to close a total of 7 group homes. So this just gives you a, as I said, kind of a snapshot of the survey. And the survey, similar to what Kathy reported, is only, it's not scientific, it's a portion of the state, but we think that it generally reflects what's going on. It's a very scary situation. People are being discharged because there's no staff to care for them, and there's not much the division can do about it. I mean, the division has said you can't do that. You can't just put people out on the street, which is understood. But then what are you going to do? You can't leave them alone in the home either. There's nowhere for them to go. In the past, we used to send them to the SODCs, but those SODCs are in the midst of a huge staffing crisis themselves. I think it's good to see that a number of agencies say they are happy with how DHS is handling things. And I think that the negative comments are very troubling. I was especially struck by the remark that the department has remained too rigidly tied to the rules. That's just that one person's opinion. So in conclusion, I wish I had a solution. The only real solution is paying staff decent wages to attract good workers and to retain them. The legislature's willingness last spring to appropriate an unprecedented amount of money to the division was a very exciting development, but it will work only if it is repeated year after year. In the meantime, as I said in my report, I'm afraid that many of our best people will just have to go back to flipping burgers at McDonald's, and our sons and daughters, including my daughter, will lose their homes. So I'm not saying my daughter will, but many of our sons and daughters will lose their homes. As the CEO said, that I quoted originally, what could be worse? So with that, I leave you, and I appreciate the opportunity to meet with you.
Thank you so much, Ed. That was really great. And I think, you know, we can open it up for questions both for Ed and Kathy, if that's okay with both of you guys. And you could either use the chat box if you prefer, or go ahead and looks like we've got a small enough audience that we could even just go ahead and speak up if you'd like.
I was all set to ask you the question of what are some solutions, even if it's really pie in the sky, that we should get behind. And so I really appreciate what you just said, Ed McManus, because I, you know, kind of feel like sometimes I'm just pounding the table and getting mad and saying this situation this is a slow cooked crisis, 30 years in the making, and we had all kinds of warning signs, and here we are. So, you know, then I think, what's wrong with me? But I feel somewhat validated right now that, like, that might be true, what I say. So anyway, on that, if there are solutions, no matter how unlikely, that we should get behind, I'd be really interested in that. But I suppose other members may have more specific questions. And I also, that was really interesting about the supportive comments that providers have made in these times, like noticing that the department is trying, like that's really kind of touching. So anyway, I'll stop.
As I said, I can't think of I mean, the basic issue is money, is paying these folks more money so they won't go to McDonald's. And I think it's great that we're starting to pay them more money, but it's so far it's just kind of a drop in the bucket. And they are the Guidehouse study said that our people should be paid 1.5 times the minimum wage. Well, that's $22, and it's going to take us several years to get there. And in the meantime, we still will have a problem.
This is Chris, and we used to have an ISC program, so I had contact with the providers in our area. I think besides the pay, and sure that it helped, but again, you talk about a CEO that is looking at retirement because he can't even hire people at $18 and $23 an hour. What I heard over the years and kind of what I saw was, and I'm not saying every agency, every provider, but more support higher up to those DSPs, whether that's through behavior support people that can help, you know, the Qs that have more training, to the administrators, but also then, I mean, even to the next level, then state support for those services. You know, when you have somebody that is beating up everybody in the house and destroying the house, and you can't find a placement, what kind of support does that agency have? I mean, it all trickles down to the direct support because they're the ones there 24 hours a day. Yeah. So that's just my kind of, I mean, yes, it is the, oh, sorry, I muted myself. It is, I mean, basically the salary. I mean, that's going to help. But again, it's, the money is only supports you so much. You need that emotional and physical support and that day-to-day support beyond that.
I think that's a good point, Chris. One of the things too that I say, and it's just an observation, okay? It's not a condemnation or a recommendation, but as our field of IDD services has gone more and more smaller and, let's say, remote, I do a lot of different work with different organizations, and one of my slides I do on a training that I do, and I feel like with this audience you'll get the reference to it, is not everybody wants to work by themselves. Some people like the Mary Tyler Moore office, right? You come in every day, you're with your coworkers, you know them, you celebrate birthdays, you get to know them, you go to dinner, you blah, blah, blah. And it's a real change in our whole service model for other groups. I talk about The Office, right? Which I was never an Office fan, but I understand the storyline. Your coworkers are your family. And as our industry has evolved and everybody's now scattered and on their own, to your point, Chris, about this feeling isolated, and some people don't want to come and work an 8-hour shift where they don't have contact with coworkers. And again, that's, there's no solution in that. It's an observation that is something we have to address for those people who both need the professional support so they can do their jobs well, but also who want that connectedness with, coworkers or comrades or whatever that might be. Our field is really evolving away from that. And I think that I knew a lot of people when I was working large provider organization who part of what they really valued was the people that they saw every day, both the people they served, but also the people they worked alongside. And as that becomes less and less of a kind of a work condition or a work feature, for some people has a big impact on their job satisfaction or their interest in pursuing work in our field. So.
Kathy, are you saying that you think that we're going to stay, a lot of organizations are going to stay remote?
No, I'm not even speaking to the sort of the central office people, Ed, but I'm just talking about in terms of still a group home where now you're down to, you have one staff on duty, right? And they're not remote, but day program, day services, which used to be largely site-based, and now the real move is toward people working remotely. But to your point, Ed, I will say that what we are hearing, and probably I suspect many of you are experiencing this in your own organizations, people, and particularly younger professionals, not even necessarily clinical IDD professionals, accountants, IT people, HR people, they are saying, I'm able to work remotely and I don't want to come back. And if I have to come back, I will pursue another opportunity where they won't make me do that. And I think that is the next wave for our industry. We're very focused on the direct support and the QIDP level, a sort of bachelor's degree case manager. I have agencies that can't hire a CFO to save their soul. I had an organization here in Chicago that was looking for a chief operations person, and the people coming into them, not from our industry, the salaries they were expecting were more than double what the agencies had on the position. And but what they're finding is that to get these people, that's what they need to pay. And then you create, and I mean, literally one of my agencies told me this, like, I pray to God our chief clinical person doesn't find out what I'm paying our chief financial person, because what we had to pay to get that person in, the gap now is, significant. And so I do think that the remote experience that a lot of professionals have experienced, some find that favorable. And I think that's going to be another factor impacting organizations as they try to continue to, have the infrastructure to provide services, not just on the sort of direct contact positions, but on the whole kind of, you all run organizations, that, there's some central essential positions you have to have in place that don't have direct contact with your client population, but you can't run an organization without them. And those people are increasingly becoming harder and harder to attract to our field as well.
That, you know what, that intersects with the workforce shortage that we've known about for decades, which is just based on predicted retirements in 2021. And here again, we didn't do much to plan for, to do any succession planning. And it also appears that people in the Gen X age range may not have been real interested in some of the behavioral health and DD fields. So finding a qualified CEO is going to be harder and harder. So I'm not surprised. And I'm happy that you mentioned about accountants and financial folks, because that's a shortage we just started to hear about in the last 2 years. And I really wasn't expecting that. So here we are.
Well, and I think, Lynn, the competition for those roles, and again, we're sort of transcending now the DSP crisis, but what I say, and it's part of a larger sort of framework as we look at kind of the future of the system, will we continue to be what is essentially a mom and pop industry, which is what we are, or will we see the same consolidation and affiliation that's impacting healthcare across the country start to encroach on our industry? But IT accountants, HR professionals, that there's they have the world of opportunities available to them is so far beyond IDD services. And so we're competing with, Fortune 100 companies for that talent pool. And we simply, unless we're there's somebody whose personality syncs with, I want to be in the nonprofit world and I want to, help. It just, there's nothing, at least with our QIDPs, we're it's a little more siloed. But once you're talking about a CFO, the range of opportunities available to somebody with that skill set is so far beyond what we can compete with. It's the next wave of the staffing crisis in our industry.
We also had a good comment from Leon. In talking about DSPs, he's suggested we need to change how we talk about the DSPs, low pay wages, high turnover. Why would I want to go into this sector? So just how we talk about them.
Yeah, no, I think that's a valid point. And I think that's something, there are some efforts to try and more professionalize or credentialize the DSP workforce, which I think it speaks to that issue, Leon. I think though, without money behind that, what's the motivation to pursue further training, further accreditation, if it's not going to be to improve your wages? And I think agencies would love to have, the more credentialed workforce, but until there's resources from the state to be able to support that, it remains up to agencies to try and fundraise their way to pay for essential services.
No, I agree with you. I'm 100% behind you on that. I do believe money and resources are required, but I also think too that it's there should be a multi approach to changing what's going on here. I think COVID has allowed us to see, highlighted just what's been going on for years. The low wages, the challenges of the job for DSP, the lack of support that a DSP would receive. And so I think having the additional resources, the higher wages, and the better working conditions, and the training, and all the things that need to come with that is essential. I also think that if I'm a person who's wanting to even go into this area, into this field, the narrative has to change a little bit. If I'm constantly hearing that, you're not going to make any money, it's a deplorable job to have working in a SILA home or a group home, then why would I even want to go into that area? We're working with university students, School of Social Workers who are thinking possibly may even want to go into this field. But I'm just wondering, does that, you know, make them apprehensive when they hear this conversation about, you know, the perils, the struggles of a DSP, you know? So I love what I'm hearing, and I just think that part of it has to be a little shift in how, what a DSP looks like, and what, you know, that's just my.
I would say that for 30 years, we've been kind of sugarcoating the situation and not being truthful about the low wages and making really kind of half efforts at changing it. It's only in the last couple of years that there have been alliances really like elevating the issue that, you know, that we can't compete. If this is a minimum wage job, we can't compete with jobs that require far less skills. So I think like this is about being honest with people, you know, because they'll come and do the job for less than 6 months, as we've seen in the national survey. 40% of national turnover is in the first 6 months on the job. And that could be related to not knowing the truth about the field until they get there. So I would say like, we probably need to change the features before we advertise it differently.
Good point.
I agree with both of you. And also, I think we're really killing the workforce that we have and driving them away. That sticking them out there, you know, alone with multiple overtimes, and as it gets harder to hire someone, we put more and more of a burden on the people that we have. So they feel more disenfranchised from the supervisors and the higher up, because they're being asked to do more and more. And so you know, they have families, or they have a life, or they have something they want to do outside of living in the Scylla, and we're just losing them in mass. The ones that, if they had support, would stay.
Yeah, no, I think Ronald, I agree with that, and I agree with that. I think what we're in a vicious cycle now, where those people who are supposed to be providing the support are working in the home where there isn't staff, or working on the third shift. I mean, and so, right, you have supervisors who can't do what they're supposed to because they're filling in. And yeah, it is a vicious cycle, I think. I agree with you. And, you know, I think that kind of continued contact with some anchor to the larger organization that says, we're here, we hear you, we value you, we know what you're doing, I'm here to support you, has eroded, because that anchor is now, you know, filling in on the weekends or doing whatever else is, you know, is caused by the crisis itself.
Well, and how do you hire a new person into that?
Yeah.
You know, they come in, they have to work for 120 hours in all the training requirements. And then, you know, the agency has supported them for that 120 hours. And then they go into this situation where they just see it's not sustainable. And then they pull out and resign. And I've heard that from our providers, that's become a real problem, that, you know, we put in and invest in the 120 hours, but it's in a system where they don't last.
Yeah.
And we drive them away.
Yeah, I think we were told the cost of turnover for situations like that, where they get through the training and then they go into the group home and like, whoa, this is not for me. I feel like it was around $2,000 a person. Lynn, do you remember if that was correct?
That was I think that was in 2017 nationwide, and without the distinct BLS classification, that figure includes turnover in home health aides and similar, you know, the others which get lumped into this classification. So for DSPs, it's safe to say 2,000 per person per year is a minimum cost of turnover, which equates to $1 an hour more. So that should have been easy.
Yeah.
Any other questions or discussion?
On that high note,
Yeah.
Okay.
Well, I mean, I will just say, I know, again, I know your authorities are, you know, very involved in your local communities and supportive of IDD organizations, again, many of whom I work with directly, but beyond that. And I think that flexibility that your resources provide organizations is very much felt and needed within those organizations. So I just want to kind of make that comment that it certainly is, you know, like I said, the local control that it brings to the service delivery system where the authorities are present really, I think, has an impact on people who are receiving services from those organizations. So I just want to make that shout out and acknowledge the work that your bodies are doing as well.
Kathy, did I hear or did I read correctly? The 1,100 hours was approved up to 1,200, but is that starting January?
Yes, agencies will, starting in FY22, which we're in now, will be able to bill for an additional 100 hours of day services, which is helpful because, as many of you know, by generally early May, then agencies have exhausted their number of annual hours they can bill for. Now, that being said, Chris, a couple of things. As Ed pointed out, CDS census has declined precipitously because of all of the various ways that CDS programs, community day services, have been impacted. So that's
or the residential provider being able to bill on for at home.
Residential can bill for the in-home day services. And the other piece is that for families in the home-based service delivery system, which is approaching half of our HCBS population, those families would have to agree to have their budgets change so that they would continue to pay for the additional 100-hour services. We don't know how that's going to shake out. I guess we'll see later in spring of 2022 whether home-based families who are attending at a full-time basis would say, yeah, go ahead and charge those extra 100 hours to my budget.
So are this to take effect July 1st of 22 or January of 22?
It is in the, it's among the amendments that are sitting in DC right now, awaiting approval. So when CMS approves it, it was submitted as part of the July 2021 FY22 package, but none of that will be operationalized until CMS approves it, which we're hoping will be sometime in January. So it should impact the current fiscal year, meaning agencies should be able to bill for that additional 100 hours in May and June of 2022.
Yeah, I think that it's supposed to go into effect January 1st, provided, as Kathy says, that the feds approve it. And if they approve it on February 1st, then would it be retroactive to January?
Well, with this one, as long as it's basically approved by late April, it'll be okay, right? Because it wouldn't need to be retro because it's sort of forward looking. So this one, some of the other ones I agree at, I think there would be some retroactivity to, not retroactive, but they'll use whatever months they have to get the money out in total. And again, for this one, as long as it's approved by, say, April, agencies would have the end of the fiscal year to be able to.
Last couple months.
use it.
Okay. Another, I don't know if I want to say comment or concern is, I think our residential or our CDS provider is only operating at 25%, maybe 30%. I mean, does DHS have any, plans to up that a little bit as the numbers are going down? But again, that's affected because you don't have the DSPs there.
That's exactly
to
it.
Staff it.
Yeah, there's no limitations being imposed by the state. And in fact, to the contrary, as somebody, I think it was you mentioned that agencies are able to bill for in-home SILA services. Well, just this week, a letter went out to agencies saying that sort of blanket approval for billing for what we call 37U in-home day services terminates on December 31st, and you as an agency have to individually determine if each person, say, living in that 8-person group home wants to stay home or wants to go to day services. So, but the issue is most agencies, again, as Ed has pointed out, are saying we don't have the staff to operate day program at 100%. And particularly agencies that operate both day and residential. If you only have 10 DSPs, you're going to put them in your group home because you have to staff that. CDS, you can say, we're just not going to open. Even for those agencies, there's about 100 agencies that are what we call CDS only, meaning they don't provide residential services. So they don't have to shift their staff to a residential setting, and we've got several members who are CDS only. What they say is we haven't been able to hire, even attempt to hire staff because it's so uncertain who's going to come on any given day. Home-based families haven't returned. SILA sites are saying we don't want people going to congregate settings where they're going to commingle with people who they don't live with still. So the CDS sort of, turning the switch back on has proven to be far more complicated than I think was originally expected. And agencies are just saying, we just don't have the personnel to operate at 100% capacity in our CDS program because we just don't have the staff.
I think that the making it 1,200 hours a year is a wonderful development, but Kathy's right that the home-based folks, that's gonna cost them money. They get a set amount of allotment every year or every month, and if they have to pay more for their day program, that means they have to cut out something else, and that's a hard decision to make. That they're spending some of their money on personal support, and they won't be able to spend as much on personal support and so forth. So that's a problem.
Yeah. And just, for people's information, the home-based allocation is increasing in January because it's tied to the Social Security payment. So really an unprecedented increase. I think it's 6.8%, which is crazy. Maybe it's 4.8%.
5.8.
5.8. Okay, I was in the middle. But again, that's because things cost more, and presumably those families are having to pay PSWs more because they're affected. It's the ripple effect. Same thing with our staff. I mean, any increases our staff have seen in wages in the past year have been eaten alive by what they pay for gas and food and any other basic necessity that has increased for all of us.
I don't have a lot of positive things to add to the conversation, but I do appreciate both of you being here, and it's nice to see you, Ed. I'm sitting here shaking my head, just saying, wow, we're smart, experienced people, and I don't know how we collectively can make things better, but we're going to keep trying. I think that we're very lucky to have Allison Stark at the head of the DDD division. When I look back at other DD directors and how they would have handled COVID and everything else that's happened in the DSP workforce crisis, yeah, there's money coming, and I think she's behind it 1,000%. But we also live in Illinois. It was hard back then. It's hard now. It's harder now. And I just appreciate everything that your associations are doing and keeping this in the forefront. And it's good to see everybody this morning. And someday I'd like to see you all in person again.
Indeed.
Is there any attempt to form a new type of service model? Like you said, Ed, other states have SILAs that are averaging 3 or 4 people in a home rather than 8. Is there other types of things we can do? Because this is extremely hard work. And I think you were right in saying that if people haven't done it, they don't understand it. Now, I haven't been in a SILA, but I was a hospital orderly for 4 years, and I worked in a nursing home after that. And they used to keep me with the people who were dying because I had been an emergency room tech. And so the person in charge of the nursing home is a nurse's aide with a LPN on call, and they stick me in with someone who's going, and there's absolutely no support. And then I was an individual care provider for a student friend of mine who had muscular dystrophy. So I would get him up in the morning and get him all cleaned up, and we'd go off to class together. And I did that for some semesters when I was down in Carbondale. So I know what the work is like, and it's not easy.
Yeah, I was gonna say something about that earlier, that our whole system and the way it's operated with our group homes is out of step with the rest of the country. I know Kathy knows a lot more about that than I do, but that the people that I talk to say that, Illinois for years has been way behind the modern way to serve people with DD, and we really need to address that.
Right. Yeah, that's my point. Yeah. Are there attempts at the top to change the service model?
Well, and I mean, briefly, it may be a topic for another day, but I agree with both Ed and Ron. Briefly, just to say, I mean, Illinois' reliance on sort of this 24/7, everybody gets everything model. There's not, in many other states, it's much more of a menu. And with another feature being that if you think of, I'm sure you're all familiar with some level of community elder services offered by AAAs and other organizations. If somebody is going in to provide homemaker services to an elder person in the community, that's what they do. And they do that, and that's what they're responsible for. And if something happens when that homemaker isn't there, there's no expectation that that entity who's providing that is somehow liable for the person. But in our field in Illinois, then there is this sense that the provider organization is this umbrella responsible for every single solitary thing. And it just doesn't work that way in other states. And so in other states, you have much more examples of situations where somebody might get 6 hours of care a day, or 4 hours, or 8 hours. And everybody understands that that's the plan. And, there's other services and supports to try and keep the person safe. But there's not an expectation that if something were to happen during one of those 8 hours a day when the person is receiving supports, that the provider organization is liable. And that's a feature in Illinois that I think really permeates our industry. It permeates our state, in terms of just the whole liability approach to things. So that's something that, we need to get ourselves away from, so that we don't just assume every person who presents themselves to the service delivery system needs 24/7 care. And we were able to truly start to customize. I do think that's a shift that is happening in other states, and maybe one we'll see here in Illinois at some point.
When Alan Bergman was at Annixter Center years ago, he did a survey of his organization, and he determined that 30% of the people who were in 24-hour SILAs didn't need to be there. They were quite capable of being what we call intermittent SILA, where they just have some services coming in, but they could stay all night by themselves and things. But of course, and that was years ago. And of course, Alan is still saying that today.
True.
I'm going to have to bow out. Unfortunately, I have another meeting I have to go to, but it certainly has been delightful to meet with you all. And I wish you well.
Great.
Thank you so much, Ed. We really appreciate you
Good
joining
seeing
us
you.
and all the great discussions. So much appreciated. And we'll make sure to share your report with everyone so they have a copy of that. It is recorded, so we'll also share this with our members and in our newsletters. So again, thank you so much.
Great.
Appreciate
Okay.
it.
Thanks, Ed. And I'll follow suit with Ed. Yeah, I mean, I've enjoyed the conversation and certainly glad to continue it with you individually or collectively. You know, I think we all recognize that there's challenges, but I think the commitment that we have in Illinois collectively through all of our different organizations is, you know, significant and is going to help to continue to shape a positive future for people. I remain an optimist, so.
That's awesome. Any other questions or discussions or anything for Kathy or? Well, Kathy, thank you so much. I mean, seriously,
Indeed.
I've learned a great deal between you and Ed both. I mean, wonderful discussion, and we will send out, and if you had, I think you'd mentioned that you had some additional material, so I'll make sure to include that when I send those items out. So
Sure will.
but thank you.
Yeah, thanks for the invitation and good seeing old friends and new. Thank you.
Thanks so
Good to
much.
see you. Bye-bye.
And I'm going to stop recording and we can finish any other business of the committee here. So let me